Hi, I'm Dr. Shepard with Align Family Wellness, and today we're going to be talking about constipation. We talk a lot about poop in our office, so sometimes that makes kids uncomfortable, and most mom and dads make us laugh. But when a child is struggling with constipation, it's serious, and we really tackle that with a lot of seriousness in our office. Some research estimate that depending on the diagnostic criteria, up to 30% of kiddos struggle with constipation. And I'm sure a lot of you adults do too, even though we don't want to talk about it. But the challenge is not just whether it's officially constipation or not, it's the fact that really constipation is just a sign or symptom of something more going on with that child's body. And it is why it's connected to so many other childhood conditions like autism, anxiety, sensory processing disorder, developmental delays, ADHD, and chronic sickness. Chronic constipation greatly impacts the child's quality of life, causing all sorts of challenges with immune system, sleep, energy, behavior, emotional regulation, and so much more. So if your child struggles with chronic constipation, you've tried to change their diet, done prune juice, probiotics, magnesium, and especially if you tried Miralax for your kiddo, this video is for you. We will break down the real root cause of chronic constipation. It goes far beyond nutritional imbalances and gut health, and get you drug-free options to help your child heal and greatly increase their quality of life. So it's not just genetic, and it's not solely nutrition, and it's not, it's not their lifestyle, but it's mostly a neurological imbalance. To be truthful, that's the missing piece. The vast majority of our patients at Align Family Wellness have already tried all the things, diet changes, probiotics, magnesium. All of that is so important, but they're missing that piece of the neurologic imbalance. So these things are so important, all of the nutrition. It just means more is going on when you're doing all the right things and nothing's happening. So clinically, we find that the majority of our chronic constipation is actually neurogenic, meaning there's too much stress and tension stuck in that child's nervous system, and the muscles of the digestive tract causing the motility are reduced, and the chronic constipation sets in. So we see chronic constipation actually correlated with a lot of other conditions. So neurologically, we call this subluxation and dysautonomia, which are two really nerdy terms that mean the nervous system is stuck in fight or flight or protective mode and is just out of balance. So when the nervous system is in a protected and stressed out state, it impacts the gut and the digestive system, mainly by conserving energy for skeletal muscles to fight or flight, and taking it away from the muscles of the digestive tract. So if you're trying to run away from the bear, you don't need to be digesting food. So when we constantly live stressed out, like we're being chased by a bear, we're not digesting. This is why we see chronic constipation in so many other conditions as well, such as autism, ADHD, sensory challenges, and anxiety. They all go hand in hand. They all stem from the same neurologic imbalance and the dysautonomia. So kiddos can respond so well to vagus nerve and parasympathetic stimulation via neurologically focused chiropractic adjustments. Hear me out. This is not just any adjustment that any chiropractor can make on any kiddo. These are specific neurologically focused adjustments to these areas that are causing this chronic constipation. So the number one way to get a child's body out of that fight or flight pattern is with these specific neurologically focused adjustments that we specialize here at Align Family Wellness. So the focus of our adjustments is to stimulate and activate our parasympathetic nervous system and the vagus nerve, which is our rest and digest system, which in turn stimulates and activates digestive motility and relaxation. So a lot of patients in our office say that we are hitting the poop button. A lot of times we adjust them and they go home and they have one or multiple poops after their adjustment. It works pretty immediately. Sometimes we're even pooped on in the office while we're doing their adjustment. That's okay. The end goal is for them to actually have a bowel movement and poop. So we jokingly even have nice little cute little onesies that say, adjustment, nap, poop, repeat, because that's really what happens. So it's such a relief for these parents to see these changes happen so quickly and so naturally without the use of Miralax or suppositories. Because you guys, Miralax is not approved for kiddos under the age of 17. And there are parents that are giving their kids constant Miralax on a daily, every few day basis for years and years and years. We have to, as parents, ask, what is the root cause? Why is my kid having constipation? Why do I have to give them Miralax every single day? Not what do I do to cure it? What's the root cause? And I guarantee you it's going back to this neurologically focused chiropractic care and stress being stuck in their spine. So if you want to learn more about your kiddo's root cause of constipation and get relief, you can send us a DM. You can check out all of our Instagram, our Facebook. We've got videos. We will answer any questions that you have. We can send you more information on chiropractic adjustments and constipation. We would love to help your kiddo get off of these medications that are terrible for them and allow them to have a great functioning digestive system.